na osofo ohwe apomuden so kwabna minta kando na nei wakasa se enne Ghana Health Information System fufuro yi a ebehye Lightwave Healthcare Information System no anemu no de no amogye wo MPP aban no emu no enne die no na se ya chemu mienu pepepe na se Canadian no na no board yie kase no etwaso.
Okay. And so in fact when we engaged them, it was my target to say, Sir Jumana, LIHMS, you know, that work, no more, you know, yeah, quite to see, amount of more charging, you know, making sure, say, be our best, Jumano, on charge up to that amount. So that nobody will come and tell you, we'll criticize you, I remember, I need to know the Eboroso. Hear me well.
Okay.
And when I make a statement, I make the statement, and I think I corrected it at the Asempa FM. Okay. I said it is going to cost us half of what LIHMS did. So the impression is that we can half of their LIHMS the 100 million. Okay. And they can half of the 50 million. Yeah. But that is not the point. Okay. Okay. Once my catcher say, "Nye be and ye for yeah. Into infrastructure no yeah. And what I mean is that SaaS software no, and any rollout, any they are making, and in fact there's an additional project and anchor. LIHMS about the middleware na make no. Into what the nyina ebomu a the omo year amount no mo the year the same thing no. The year kwakofa by half of what the LIHMS charge.
So how much did it cost us to get the software from LIHMS?
I don't want to put the figures out.
Honorable Minister of Health.
No, I won't put the figures